Okay. Our main objective of this session, everyone should be able to recognize the strategies that can be implemented to reduce the patient radiation dose in computerized tomography, as well as who is responsible to implement these strategies leading to minimizing patient radiation dose. Okay, as you know, there is a growing in the request of CT scan procedures, and nowadays hospital and clinics all over the world, they are greatly expand the utility of CT imaging, and this is related to the high quality images that enable patient to benefit from the accurate diagnosis, leading to therapeutic procedures during the treatment journey. However, in spite of this contribution of CT, some attention must be given to the possible risk associated with the ionizing radiation, as Prof. Abdulmunem mentioned. And for that, reducing the radiation dose is not a responsibility of one party. It is a community responsibility. Let us name it city community, and it is a top priority for this community to find how to reduce patient radiation dose while benefiting from these high quality images in order to diagnose any certain problem. Why dose increased? In continuation to what Prof. Abdulmunem mentioned, as you know, image quality and dose are dependent factors, and generally, especially in the digital imaging, increase in the image quality require an increased dose. And for that, considering this point is very important, because we need always to take in account to balance between patient dose and the level of quality required to diagnose a certain problem. So we are not seeking a high quality images, and always we are mentioning that we need to think about optimal or acceptable image quality that will help or support the purpose, diagnosing a certain problem. So let us hit the target and explain how to start, from where to start. To start, we consider three factors: equipment, facilities, operational standards, and the human, the application. And each one, it had many subtitles. For example, for the equipment, we need to consider the system performance by quality control testing. Okay, this is just an examples for possible quality control test procedures that can be performed to make sure that everything is working well. For optimizing the practice, we need to have certain criteria related to referral, clinical referral, how to educate our patients, what about patient preparation and care, what are about the protocols itself, is there any guidelines for specifying the image quality, and if there any benchmark related to this area, and how is the reporting by the radiologist, as well as the dose limits. There any established diagnostic reference levels? There any variation in the dose? What are the requirements to avoid these variations? For the application, human factor, which is very, very important, we need first of all to specify what are the responsibility, who is responsible to minimize the patient radiation dose. And meanwhile, we need to think about what about the qualification, the skills of those who are involved in this CT service, and their commitment to the regulations, to the standards, and their cooperation team, as well as considering training during the practice, as the Prof also mentioned the training, because training is essential through continuous professional development. To start, we need to think about a quality assurance program as a baseline. And as you know, it's the main objectives of any given quality assurance program for radiology is to provide accurate and timely diagnosis with accurate patient safety, including radiation dose, and controlling of the service cost. Also, to start, we need to consider a lot of principles, and this is including the justification of the exam, optimization, and limitation. And this is covered by Prof. Abdulmunem, but I will talk in some details about the process of optimization. Justification, it's related to that the exam must be medically indicated, and this is a responsibility of the referring physician, and we will come and cover this in the coming slides. Optimization is related to the exam must be performed using doses that are following a lot of principles and consistent with the diagnostic task. So the optimization process involves several steps. Initially, we need to check the status, the performance status of our equipment used for these CT procedures. And then we need to establish clinically appropriate image quality requirements in collaboration with the clinicians who are benefit from these images. And we need also to determine the patient doses. Okay, this is actually done through a patient audit or by using Vantoms-based measurement in order to start the service. And this is in the quality assurance, it is related to the initial quality control testing. Before using these machines in real clinical environment, they need the team, the quality control or quality assurance team, they need to apply certain Vantom imaging in order to calibrate the system and to specify radiation dose limits for each given procedure. And also this should be followed by reviewing the scanning protocols in terms of the purpose of the exam and patient size, for example, with giving attention to any pediatric protocols, because pediatrics are more sensitive to ionizing radiation compared to elderlies, as Prof mentioned. So gathering this together will be the initial step for optimizing the practice. Then after optimization, we need to review the current status of procedure after optimization by monitoring and compare the examination dose with appropriate benchmarking, such as diagnostic reference levels. Okay. And compare also the image quality with the appropriate benchmarks, such as the European guidelines for CT image quality. And after that, we need to recommend changes if there is any variation, changes to the protocol, changes to the equipment configuration, changes to the diagnosis and reporting. And this will be the basis of reviewing these procedures. After that, we need to, after collaborating all these optimization processes, and we have a clear guidelines that should be followed by the different parties, then after an agreed period by the committee, we need to verify the effect of this optimization process. We need to check or to examine the effect of this process, whether there is positive results or not, and we need to repeat dose and image quality analysis to determine the effectiveness of the optimization intervention. Limitation, it is occupationally exposed individual like radiologists, technologists, and to patients undergo necessary radiological examination should be limited to level recommended by the international organization, or should be compared to also to standard benchmark. Also, to start, we need to adapt the factors affecting the patient dose, and these factors can be categorized in relation to that three factors: equipment factor and the standards and the human factors. So there is factors related to the system itself, and there is factors related to the application of the procedure itself. Okay, who is responsible? This is very important to have certain guidelines that could help on real clinical practice to reduce patient radiation dose. I'm trying to make it very simple in order to convey a clear message for those who are dealing with patients during CT imaging, that they can apply something that could help in reducing patient radiation. So the responsibility is the teamwork responsibility. We have the referring physician, the radiologist, the technologist, medical physicist, manufacturer, and even regulatory bodies internationally. So always think about that. Reducing the radiation dose is the teamwork process. It's not just related to certain person. Many people think that this is the responsibility of the medical physicist. The medical physicist is part of the team, and without our help, yes, he's responsible to monitor, to analyze, to record and analyze those levels and provide reports. But at the same time, without our help, he or she will never be able to organize and to achieve a better outcome for the CT department. The physician, as you know, it is a justification. We need to ensure, the physician should ensure that the patient are not irradiated without justification. So the request should be generated first of all by qualified medical practitioners, and it is his or her responsibility for weighing the benefit against the risk, and whether required information can be obtained, for example, by ultrasound or by MRI. And this reflects the importance of continuous professional development in order to be oriented with the current advances in relation to the possible modalities that can diagnose certain abnormalities. In addition to this, the clinical guidelines. We are the technologists, and many of they are facing sometimes some problems associated with these clinical guidelines. Without having a clear clinical guidelines, the technologists will not be able to apply the correct protocol and select required protocol parameters in order to apply those parameters that could help in minimizing the radiation dose. For example, if I am going to apply a CT chest, this CT chest could be a high resolution CT chest, it could be a standard CT chest, it could be a low dose protocol CT chest based on the clinical remarks. So it is very important that the referring physicians should provide us with the clear clinical guidelines and details that will help the technologist to apply the correct protocol, as well as helping the radiologist to write down final report about the case. And many times you may have many pathologies with the same findings within the CT image, so the radiologists need to have some details about the clinical history in order to differentiate between one disease and another. Okay, the radiologist, many responsibilities, starting with managing and monitoring all the protocols and arranging with the physician to consider the required information may be obtained by MRI or ultrasonography. It is not just having the request, we need to proceed. We may need to discuss this with the other technologists, with the radiologist, and the radiologist can open conversation with the referring physician, and the ultimate goal is to minimize the patient dose. So if this pathology can be diagnosed by ultrasound, why we apply computerized tomography? This is the question. Okay. Also, we need the radiologist need to consider the value of contrast medium enhancement before commencing the exam, because if we need to inject contrast media, we may need to scan the patient pre and post contrast, and this will induce more radiation patient. And also CT exams for research purposes should be, we need to be careful about this point, and any given CT examination should have an immediate benefit to the patient, and don't think about having extra cuts, CT cuts, for the purpose of research, and any research purposes should be subject to the evaluation of the ethical or ethics committee. As we mentioned, the physician and the radiologist should open the door for direct consultation in order to assure that performing this CT scan is applied if only indicated. Okay, as you mentioned, we need to encourage using an alternative non-ionizing image procedure such as MRI and ultrasound, and we may think to apply a regular scientific meeting, or name it workshop, in order to exchange the experience and to discuss the factors that could be applied in order to minimize the patient radiation dose. The technologists play a central role in the radiology department, and many of their responsibilities as the technologist depends on effective communication with patient, taking histories, reviewing the patient, identifying the procedure to be performed, screening for safety, providing instructions, and ensuring that the patient understand all instructions, answering questions, and explaining the post procedure care, and coordinating the patient care with efficient use of resources, available resources. So the technologies play a major role in the radiology department, which end in increased patient safety and minimizing any risk associated with exposure to ionizing radiation. So this is the patient education, communication, preparation, and care is the key success of any given radiology procedure. It's not the CT procedure, ultrasound, MRI, X-ray, whatever the procedure we need. This is the basis or the backbone of the success of our procedure to provide sufficient patient education, communication, preparation, and care. And the technologist, the most involved person in this process. So for patient education, always think on daily basis on how to establish an effective patient education policy. We need to benefit from the current advances. We can initiate a page within the hospital, within the radiology department. It depends on the size of the facility. And also, it is simply we can create a file with a QR code for specifying each procedure, and this file containing frequent asked questions. The frequent asked questions associated with the procedure can be sent through emails or can be sent through WhatsApp, for example. So the patient will read these guidelines and he or she will become relaxed, and when coming to the procedure, this will minimize the effort, technologist effort to explain the procedure and to assure the patient regarding any given CT procedure. So nowadays we need to think about creating these QR codes for certain files that can be sent by the media for the patient before the appointment. So very simple questions that can be answered for the patient, and this definitely will enable better assurance for our patient, and the patient will be relaxed. And whenever the patient is relaxed, that means we will not face any problems related to patient anxious or whatever. In addition, patient communication, preparation, and care, we need to apply psychological preparation. And Dr. Mahdi talked about the smile, and we need always to smile to our patients, and we need to leave our social problems behind our back when we reach the hospital, because the patients in need of our help. So we need to provide psychological preparation, listen to the patient, as Dr. Mahdi mentioned, and we need to check the regular for any possibility of pregnancies. And also, this is a very important point related to the dress preparation, gowning as required. This is very important because patient gowning, it is related to complying with the patient privacy as well as infection control. So we need to be careful about this point, in addition to specific preparation that required for contrast media procedures such as fasting and so on. All this, any failure will be translated into increased patient dose. because this will affect the outcome of the final exam, and we need to make sure that we are applying all these aspects consistently without any possibility of patient anxious or whatever, which will affect the final image. Also, the technologist is responsible for adequate protocol selection in relation to the provided clinical history. Is it routine, high-resolution CT, low-dose protocol, contrast-enhanced, non-contrast enhanced, and this is with this consultation with the radiologist and the referring physician. And if there is insufficient requisition data, we need to confirm the real purpose of this exam rather than imaging the patient, and we may find that we are selecting the incorrect protocol. So inadequate protocol also increase the patient dose. Patient positioning, this is a direct responsibility of the technologist, and aligning the patient correctly on the table with correct centering with the CT gantry reduces radiation dose, because we will have the required information without any errors. And from the practice, inaccurate positioning may lead to patient movement during the scan and may result in scan repeats. On the daily basis practice, if the patient fully extends his legs, most of the procedures, the patient is lying supine. So when everyone lying supine, there will be gap here in the waist area. So flexing the knees partially reduces the lumbar curvature, the lordosis, and bringing the back closer to the CT table, and this allows greater patient comfort, and this results in reducing the possibility of motion artifacts. So many times this point may be ignored, and the result will be additional dose because we may need to repeat certain scans. Also, the technologist is responsible for limiting the scan volume and to avoid any extra images not related to the required anatomical area of interest. For example, here, if we are imaging the chest, even in the scout here, you have to notice that even the patient arms are included in this scout. Okay, so practically for a chest, we need to cover, for example, from up the sternal angle or jugular notch and down to include the costophrenic angles. So all this area is considered exposed area without any justification. So decreasing or adjusting the scanned volume to the required area will lead to decreasing the patient dose. Slice thickness also, decreasing the slice thickness, as you know, the image quality improve the details, but it requires increased dose, and this slice thickness should be implemented only when necessary. And this should be specified in the agreed protocol in the manuals, quality assurance manuals, and should be followed by the technologist. If there is need, okay. But selecting thinner slice thickness without justification will lead to increased patient dose. These factors covered also by Prof. Abdulmunim, the milliampere second, increasing, everyone knows that increasing the milliampere second increase the dose, slice gap, decreasing the slice gap in single slice imaging, resulting increasing the patient dose, And the scanning pitch, the movement of the table throughout the gantry, with single slice helical CT, decreasing the pitch, increase resolution, but result in increased dose. This pitch is programmed in the wall as well as the MAS and the KV, but the qualified technologists also have the ability to modify these factors if required. Always remember that high quality images may look nice, but it has a price. And here, this is an example. This is patient with the lesion within the liver. And this image is quite enough with quality, which is quite enough to diagnose this lesion. And the dose about 4.2 milligram for the same patient. Okay. High quality image with 12.6 milligram also provide a high quality image compared to this one, and also will diagnose the same problem. So what is the value of using this radiation dose if we are able to have the required information by obtaining a lower quality that could help in diagnosing the problem? So always think about optimal image quality that fits the diagnosis. It's not just seeking a high quality image, because the high quality image, it has a price which related to more radiation dose. Body shielding, additional body shielding is very important. We need to shield the superficial and sensitive organs such as thyroid, breast, eye lens, and we can apply additional shielding which result in dose reduction. So in daily basis, we need to apply this, and please don't try to apply the additional shielding, because it will help also in reducing radiation dose, especially for these sensitive organs. The medical physicist is an important part in this journey, and he's responsible, or she is responsible, for quality control testing, starting from the specification or purchase specification, and acceptance testing, critical testing, monitoring testing, repair, dose measurement for the staff, analyzing the dose and documentation of those, in addition to establishment of diagnostic or dose reference levels in collaboration with the other team members, as well as plan for any required corrective actions if there is any variations compared to the international recommended values. The manufacturers also, they have continuous effort, and these efforts it's displayed now in the current generations. They introduce automatic exposure controls. They include safety features such as ampere modulation, display of those, separate protocols, for example, for pediatric patients and adult patients, and so on. So there is a continuous efforts by the manufacturers, and also the competition between these manufacturers is an added value, because each manufacturer try to give the best from his size in order to capture the market. The regulatory bodies also, there is continuous gathered efforts and research. Okay. Practice updates continuously, and this is the result in improvement in terms of image quality and radiation dose. And always, even in our practice for any given CT facility, we need to refer to the recent published information about image quality and radiation dose, which published internationally in order to update our practice based on this. Because we may have, for example, manuals 10 years ago, but nowadays out of date. We need to update these manuals based on the current advances and recommendations that recommended by the regulatory bodies. In conclusion, we need to mention that these strategies reduce patient radiation dose, and we need to link it to the image quality, because the ultimate goal is to balance between the patient radiation dose and the image quality at the same time, balancing to have the right diagnosis. So this could be achieved through a comprehensive quality assurance program, which considered as the backbone of any given radiology service to improve image quality, reduce radiation dose, and to control costs. And it is a team effort. It is not an individual effort, it is a team effort, including the medical physicists, the referring physicians, the radiologists, and the technologists and radiographers. All these together, or following the standards, following the criteria that is specified in the manuals, quality manuals, and through certain steps after setting the standards, and we need to check the compliance with these standards, and we need to correct any bad practices with the quality improvement, and we need to set new standards if there is bad practices, and we need to repeat the action in a circle continuously. And besides this, we need to think about staff training and patient education, which will enhance the practice and will lead to better outcomes. At the conclusion, always the justification of practice in CT is the baseline for radiation protection, and we need to think about having adequate clinical information. Okay, and after that, as a team, work together to balance between the image quality and radiation dose as a shared responsibility. At the conclusion, to reduce the patient radiation dose and to have an optimal image quality, we need to establish diagnostic reference levels for all procedures based on the international URLs, and we need to develop an image quality criteria manual following the international standards also, with emphasis on staff training and patient education. Thank you very much.